All right, Edson, thanks a lot. I'm sure you're going to stay on top of it. All right, now we're joined by Republican Congressman Brian Bilbray of California. Sir, thank you very much for joining us. What about it? You know, we keep hearing about Pelosi saying she's got the votes. She may not have the votes. She needs more time. Catherine Sebelius is going to talk to Democrats. What do you think? Are the votes there?
I'm just looking into this morning. There's a lot of arm twisting going on. There's a lot of whipping, as we call it. And frankly, I think that there's a real concern about Pelosi asking her vulnerable Democrats and her moderate Democrats to walk the plank for her before the Senate even takes it up. You know, and the Senate doesn't know if they're even going to be able to use that maneuver they keep talking about, the reconciliation, because the parliamentarian, somebody that works for them, may rule against them and say no, and then you end up creating a whole new problem of backroom maneuver. So now it's a tough one, but there's a lot of pressure going on. I think what happened was there were polls done last week that says the damage has been done to the Democratic Party, and their attitude is we might as well shove it through because we're not going to be any less punished at the polls next year.
Congressman, is it your sense that the Blair House Healthcare Summit was sort of a prelude to this move to do the reconciliation bill where you just get 51% of the votes? That, you know, basically it was a way to, you know, just set up the debate and give the Republicans a voice and then just ram it right through?
Absolutely. They wanted it because people were outraged, and even the president says it was process that people were outraged about. And so that they try to make it look like there was a fair process. I think we pointed out that, you know, even the president spoke more than the Republican representatives. But the moderate Democrats that had voted against it were not included in that meeting. And so obviously if it was a real substantive meeting to get something consensus, they would have been included. And I think that now they're scrambling, trying to figure out how to coerce, beg, promise these guys to be able to vote for this bill, and it doesn't sound like they're going along.
Congressman, quick follow-up. Representative Paul Ryan comes out with his analysis saying that health reform will add to the deficit, noting the Medicare doc fix could be postponed. That could add $250 billion to the deficit figures. Do you feel like the American people are buying the president and the White House and Congress and Democrats in Congress saying health reform will not add to the deficit?
No, I don't think they're buying it. In fact, Paul Ryan, everybody knows he's got his numbers right. He's proven their side false many times. And the American people, you know, look at this and say, look, this thing doesn't pass the smell test. You're promising us all these things, and it doesn't reflect in the thousands of pages that we're going through. So I think you're going to see the American people are looking at Paul Ryan. He has credibility on this issue. And frankly, I'll tell you, I think that's why you're going to see him attacked viciously, because they see that he's a messenger that they don't want running around telling the American people what the end game is here. Promises have been broken in this town for too long. We've got to start talking about earning the trust rather than continuing to ask trust from the American people.
Congressman, hold on one second. I have to get to this. You know, there was reports this morning that there may be the Obama administration has gone so far as to offer a judgeship to a brother of a representative for a vote. Have you heard anything on that? And does it surprise you?
No, I would not. I've not heard about that and whatever. And look, you know, there's a whole lot of politics going on here. Sadly, a lot of it, you know, appears to be Chicago politics, which I don't think the American people are comfortable with. But I have not heard that at all. I would not even bring that up. But I would say there is a whole lot of arm twisting and persuasion going on, because people think the political career of not just this president but of the entire party politics here is at stake on this thing. And I think they're risking everything on something that is not going to fly in the long run, either politically or substantively.
Congressman, I'm curious, how do you think about health care in placing America at a competitive advantage for its workers with better health care?
Well, I think that it's important, but I don't think it is the foundation of, we need regulatory reform across the board. I mean, I'll give you an example. How can you talk about health care and cost and not be talking about the tort issue here? Except the trial lawyers are not, you know, are behind the scenes making sure nothing gets moved. You know what? We provide special tort protection for doctors who work at community clinics. The federal government has said this is important enough to where we've got to get lawyers off of the doctors who take care of community clinics. well, we're doing that for the poor. Why aren't we doing that for the middle class?
Yeah, and I don't know why you can't set up a medical court. We have specialized courts for the tax court, bankruptcy court, workers' compensation courts. You make a great point here. You know, another issue, too, and this is important, with the health insurance CEO meetings today going on with the White House, Henry Waxman had called for hearings in late summer, fall of last year, and was going reportedly to subpoena health insurance companies to get at their CEO pay and sort of shame them into backing reform. Whatever happened to those hearings?
Well, what happened in those hearings is Mr. Waxman's bill actually had in it a hold harmless for death caused by denial of services by insurance companies while they were punishing states that had any tort reform at all. So obviously the problem here is none of this has been done in the light of day. The public has not been able to see any of this. And no matter what, the public's not going to trust it when you do these backroom deals. And they're imagining the worst. And frankly, we've got to do more to prove to them that it isn't as bad as they think that it is. And frankly, I think that we've got to go back and say, look, everybody should be working together. Last week, the Republicans joined with the Democrats at eliminating the antitrust protection for the insurance companies. My question is, will the Democratic majority be willing to put their trial lawyers in the same issue and start limiting them? We've got to be able to do a quality control health care without having judges do it in back rooms.
All right, we have to leave it there. Thank you very much, Congressman Brian Bilbray from California, Republican. Thank you.